Thank you for joining us today. My name is Jody McGinnis Porter. I'm the Communications Director for the Department of Health, and I'll be moderating today's press conference. Today, Dr. Grace and Dr. Petahon will provide an update on COVID-19, RSV, flu, and monkeypox. Also joining us today is Dr. Anna Duran, Associate Chief Medical Officer at UNM Children's Hospital, and she'll give us a firsthand perspective regarding the increased number of children coming in with COVID-19, the flu, and other respiratory illnesses. After the presentations, we'll take questions from our media partners. When we get to the Q&A portion of the press conference, please raise your hand in Zoom if you'd like to ask a question, and I will unmute you. Right now, I'll turn it over to Dr. Grace to go through his presentation.
Thanks very much, Jody. Appreciate you all being here today to go over what's been happening in the state in not just COVID anymore, but all the other various changes in infection patterns in our state, with a very important discussion today about RSV as well. Let's go to the first slide though and start with COVID. And so there we are. You are familiar, I hope, with these curves on the left. You can see our cases that we have in our state by date of collection, going all the way back to the very beginning of the pandemic. I always reflect on how we thought the wave in April, which you can't even see anymore, was such a big wave in April of 2020, and then a really big wave in July of 2020, which of course have been dwarfed ever since. If you go all the way to the right side of the graph and you know about the gray area, the data is not all in, but it can only go up. You can see we're clearly on an upward trend with COVID cases in the state, and we are seeing more and more patients with COVID lately. Another thing to point out too, though, is after the really big spike in January, February, many of us New Mexicans switched over to home testing, and it's not feasible to actually collect that data in an accurate way since a home test doesn't meet the CDC definition of a test. So we know the case counts are maybe 2 or 3 times higher than what we're reporting. We don't know the exact number, but we're clearly on an upswing. And in our last public health order that DOH issued in, I think it was August 13th, we did really advise all New Mexicans to pay attention to the graph or the map of New Mexico that you can see on the right. This is updated on a regular basis at the CDC website. It classifies counties in New Mexico and according to COVID levels. And you can see we've got green, yellow, and orange. And just a reminder that on that same webpage, the CDC provides specific guidance for what we should do if it's green, yellow, or orange. And so, for example, in the offices of both HSD and DOH, we print this map and put it up on the wall every week. And this week we're wearing masks again because we're in the yellow range, actually in the orange range now in both Bernalillo and Santa Fe counties. So please pay attention to that. Please take extra precautions if the county you're in right now is colored yellow or orange. And that's why we put that in the public health order, because we think this is a nice nationally standardized way to know what kind of activity we're seeing in each county. And we've transitioned away from the DOH specific reporting because we send all the data to CDC to their reporting. So it took a long time on that, but this is a very important slide. And you can see almost half the state now, in terms of number of counties, is yellow or orange, but way, way more than half the population is in a yellow or orange county right now. Next slide, please. Hospitalizations have doubled. You have to kind of squint at the graph and go back, toward the low point, which was early October, but we've seen more than a doubling of the number of people in the hospital with COVID as a primary diagnosis. But again, good news, a lot lower percent of people on ventilators, about 3% right now. And those of you who remember the beginning of the pandemic where that number was higher than 20%, and then Omicron where it was at about 10. And so that's come down nicely. We still continue, though, to have people die pretty much every day from COVID, and that death count continues to mount. And our hearts go out to every family who's lost someone to COVID. By now, it's almost every New Mexican knows someone or has someone in their family whose life has been lost to the infection. Next slide, please. I wanted to show you this. This is a slide we review every week. We don't share it with you as much. And this is the number of people who got a specific treatment divided by the number of cases that are officially reported. So again, the number is a little higher because we don't know the number of cases that didn't report in, but you can see here that we're doing a great job. The orange bar is Paxlovid. We've pushed that very, very hard. It's a tricky medicine to prescribe with people on other medicines. I just wanted to thank every prescribing clinician in New Mexico for ensuring that anybody with a symptom, a positive test, and a risk factor gets on to Paxlovid. So we think of the reported tests, we believe that most people now are getting treatment with either that or molnupiravir. And I'm going to say a little bit more about bebtelovimab, which is the only monoclonal antibody we are using today. Sotrovimab we stopped using because it was resistant to the Omicron virus, or the virus was resistant to that drug. And then I'll talk some more about drugs when we look at the variants that we're seeing now. But we feel like we're doing really well. And again, based on some data that we have, like vaccines, New Mexico is managing to get treatment to people no matter where they live. Nationally, if you live in a rural or high social vulnerability index area, you're only half as likely to get oral treatments as you are in an urban or low SVI area. But in New Mexico, that treatment rate is equal. And I want to thank Presbyterian. Again, we've shown that data in the past, but thank them for their monitoring that. Next slide, please. Here's the variant map. It's kind of, someday I think it'd be a cool wall hanging. It's very colorful, lots of art. I'm not going to go through the whole thing, but if you look way, way back, that black is Delta, and then Omicron, BA1 is the orange, and then BA2 is the blue. And you can see what happens with the virus is it's still constantly changing, still a big challenge to stay on top of, but now we're getting out of the BA4-5 set of variants that we had all summer. And Brianna's labeled this because I struggle with colors, but you can see BQ1 and BF7 are now taking over. And if you look really closely at the top of the BQ1, those two added together at 50%. So yeah, right there. And I wanted to say something about that because while Evusheld had effectiveness, although reduced against BA5, which was our predominant variant, that's the yellow one, even though the color changes a little bit. While it was effective against BA5, it is not effective against BQ1 and BF7, the new variants. And unfortunately, neither is bebtelovimab. And so we are now addressing and meeting with the medical advisory team tomorrow to determine whether we will continue to provide those treatments since they no longer work against this new evolved version of the virus. So that's on the docket for our agenda tomorrow morning. Also, the good news is, though, that remdesivir, the old standby that we've used both as an inpatient and outpatient, although it's IV, and even more conveniently Paxlovid and molnupiravir, should always have activity against COVID, or at least we hope they do, because they're basic antiviral meds. They're not tailored to the spike proteins, for example, on the COVID variant like bebtelovimab and Evusheld. And so they're good antivirals, and we know they work very well. Paxlovid, again, just my commercial. If you have a symptom, a positive test, and a risk factor, your chances of being hospitalized and dying, if you get Paxlovid, are 90% lower. And so that's been a really, really important tool along with vaccines in our armamentarium to continue to fight this evolving virus. Let's go to the next slide. We get a lot of questions about long COVID. I'm involved in a lot of conversations. We're starting, and it looks like we didn't quite update this slide all the way, but we all know that long COVID exists. The previous data was that somewhere between 5 and 20% of people may develop long COVID, as defined as having symptoms more than 6 months after a diagnosis. 1 in 3 patients who have long COVID have these symptoms between 3 and 6 months. So this is a really significant subset of the group of people with long COVID. And we're also finding, if you look at that 4th bullet, about 40% of people who had long COVID features in the 3 to 6 month period didn't have those features before. So this is a new thing. We've always thought of long COVID as you get COVID, you have symptoms, those symptoms persist for a while. But now researchers are finding that you can have long COVID, you can have COVID, your symptoms can resolve, and then symptoms can reemerge. And so this is something we want to keep a close eye on. And I'm in contact with our delivery systems, the medical advisory team, about making sure that we're responding over the long run to have resources available for people who want to be evaluated for long COVID. And so this is something will be a significant public health issue. It's a workplace issue. It's, it's a health issue for the people who have it, certainly. And so we will be watching this really, really closely. Next slide. We're doing well. So there's 2 ways of looking at how we're doing with the booster. Compared to all the other states in the country, we're doing well. And you can see the color coding here, and we've got between 15 and 20% of our population vaccinated. You can see in Minnesota and Vermont, they always do really well on everything. And if you're wondering, like I was, what that giant island floating off the coast of North Carolina is, that's, I think, just an enlarged version of Washington, DC. They're doing well. But on the next slide, I think I can show you the actual data. So the green bars are the number of people on any given day that have gotten the booster, and the blue line is the cumulative number. So the green bars refer to the axis on the left, and we've had days with people, over 6,000 people getting the vaccine in a day, and you can see we're up to, somewhere around 230,000. Actually, it says 239,094 doses given so far. I've already gotten this vaccine. I was super excited because we had the vaccine in my clinic when I saw patients about 10 days ago. And we were able to give, I think it was 6 people on my schedule, the booster right in the office. And so that's where this will all be evolving. And you can get it at your primary care doctor's office in the future. And of course, pharmacists, who are the main provider of the vaccine. So we're making progress. I think we're getting better and better evidence every day that this vaccine is effective against the Omicron infection, the booster is, and it also is reducing hospitalizations and deaths, like we saw at the beginning with the original vaccine. And I've gotten a lot of emails lately on another vaccine-related topic we'll get to, and people are saying it's been proven that the COVID vaccine doesn't even prevent you from getting COVID, which is actually not true. Your chances of getting COVID are much, much higher, more than twice as high, sorry, I should say, if you're not vaccinated. But the real reason to get vaccinated, and now with this booster, is because of the dramatic reduction in hospitalization and death. And so those people who do get COVID are, not as ill. And as we've gone through this recent surge, we've had a lot of people that I know of anyway that have gotten COVID, and but the vaccinated ones have done well and stayed out of the hospital, which is the reason really we're getting the vaccine. And that's true of other vaccines as well. It may not completely prevent you from getting the illness, but it makes it much, much milder. Next slide, please. So it is safe to receive both the flu and Omicron booster at the same time. My wife and I both got them on a Friday afternoon and kind of laid around the house on Saturday about 2 months ago because I had a little fatigue and muscle soreness, nothing too bad. And we were out hiking our 4-mile Sunday morning hike the next day. but encouraged you to get it. Pharmacies, primary care doctors, public health offices, all offering the vaccine, and you can still go online and schedule your vaccine at our website. You can also call your primary care doctor or provider, nurse practitioner, physician assistant, see if their office is giving the vaccine. And I just want to encourage everybody. I never ask people to do anything I wouldn't do. And in this case, I've already gotten the booster, would encourage you to do that. In particular, very, very strong encouragement if you're older, or if you have a significant risk factor, or you live with someone who's immunocompromised. I think I have one more slide, and I'm going to turn it over to Dr. Parahone. Yeah, interestingly, a lot of interest in the vaccine recommendations for next year, school year. We have a committee, an advisory committee of specialists that get together and sort of talk and debate, and that's available online. The new recommendations. There were no real significant additions to the schedule. There's like 10 different vaccines that people get to attend school. Most notably, one's the HPV vaccine, human papillomavirus. It's a vaccine which prevents people from getting cancer, which we don't have a lot of those vaccines. So that's a good one too. And we strongly recommend that. And as usual, we recommend the influenza vaccine. We've never mandated that and are not now. And also with the COVID vaccine, we also recommend the COVID vaccine, but that's not required for admission to school. And then the newspapers this morning did a good job describing other ways of opting out of vaccines. Those are available to people. And I just wanted to thank, I got a lot of emails from people on both sides of this issue. And I think the decision that was reached based on the opinions of our specialists is a good one, and does offer families the flexibility to make their own decisions. But you can see this girl in the picture. She's extremely happy about getting her COVID vaccine. And so hopefully your kids will be that way as well. Let's go to the next slide. I'm pretty sure I'm about to turn it over to Laura Parahone to talk about some of the latest data of what we're seeing in the state around not just COVID, but other respiratory viruses as well. And the results are different than previous years. So Laura, or Dr. Parahone, sorry.
Thanks so much, David. Thanks so much, everybody, for coming on today as well. And I just wanted to share as well, before I share a little bit about the triple threat of COVID, flu, and RSV, is that I recently got COVID. Many people who know me may be surprised because I wear my mask everywhere, but I got it from my kid. So I guess, if you have kids, you can still get it from them when they come home. But anyways, I was vaccinated. I had a booster, and I really think that because I had the booster, I got much less sick than I would have. I have asthma, and so anytime I get like a respiratory illness, it really hits me hard. But I think one of the things that people think is like, oh, well, if I get the booster, I'm not going to get COVID. Unfortunately, Omicron is really, really infectious. It's super contagious. And so if you do get it, if you're in a room with, your kid, you could still get COVID. And so I think it's really important for us to recognize that the booster is doing its job. I'm here today and feeling pretty good. And I also, because I have asthma and I'm older, I also got Paxlovid. And it was important, just as a reminder to everybody, that if you do end up getting COVID, there are tests you can get your test easily. You can either, we have a Project Act where you can go online and get tests for COVID, or you can, if you do have insurance, you can go to, one of the local pharmacies, and you can get actually up to 8 tests a month. And so just encouraging people that if you do get sick, if you do have symptoms, stay at home, get tested. On my first day of symptoms, I didn't test positive, but I still stayed at home in case I had COVID and didn't test positive until my third day of symptoms. So just kind of little reminders that, yes, get your booster. If you are, like David said, if you have symptoms, you're at high risk, and you test positive for COVID, get your Paxlovid as soon as you can. So yeah, so anyways, just wanted to share that. In terms of the COVID and flu and RSV, we are seeing a lot more influenza-like illnesses now than we have in previous seasons. So if you look at here, you can see the New Mexico, yeah, if you can, yeah, thank you so much, Brianna. You can see that we're actually having many more influenza-like illnesses than last year. Our cases of COVID are rising steadily right now, but in addition, we are having a high rise in flu cases in New Mexico, not just in New Mexico, but in the whole United States. And also our RSV cases, which Dr. Duran will be talking about, a lot of cases of that rising as well and really affecting our kids really badly. So these three illnesses are out there right now. Be careful, if you get sick, stay home. The vaccines are still your best protection. So if you haven't been vaccinated for COVID or haven't gotten your booster yet, please go get your boosters. Same with flu. We have flu vaccine for people 6 months and up. So please go get your flu vaccine. And like I said, it may not always prevent an infection, but it still offers the best protection against severe illness and death. So please go get your vaccines if you can. Stay home when you're sick. Wash your hands a lot when you're sick and wipe down surfaces so you don't get the rest of your family sick. Okay, next slide. And definitely wear a mask when you're sick. And then when you're recovered, if you're still coughing, wear a mask at work or when you're out and about. So this is kind of the data on RSV and rapid flu data that we have. And you can see here in the blue, you can see we're having an increase in RSV and then same as flu. So just, this is circulating around. And so as we go into the holidays, I think the best gift you can give yourself is get vaccinated, take care of our elders who are more at risk of getting very ill if they get illnesses like flu, RSV, and COVID. Next slide. And just a small monkeypox update. Next slide. Once again, just in case anyone hasn't been following us, the monkey cases in US and New Mexico, globally, 80,064 cases of monkeypox. In the US, 29,055 cases. And in New Mexico, we have only 52 cases. And actually in the past month, we've only had 2 cases. So really significantly slowed down. Kudos to our whole monkeypox vaccine team that have been vaccinating throughout the state and really decreasing the number of vaccine, related illnesses. And then deaths in the US is 11. Monkeypox is a viral infection in the same family as smallpox, and it doesn't usually cause serious illness, but it can result in painful lesions or sores, rarely results in hospitalization or death. Once again, it spreads through close physical contact between 2 people, and anybody can get monkeypox regardless of sexual orientation, gender, or gender identity. So once again, it's going down, but if we still have a lot of people coming into contact with each other, we can still spread it. So still take precautions. And yeah, thanks again. I think that's my whole monkeypox set. And I'm going to now introduce Anna Duran, Associate Chief Medical Officer at UNM Children's Hospital.
Thank you so much.
Children's. Thank you.
Thank you. Thank you also for the opportunity to discuss what UNM Children's Hospital is seeing and our response to the respiratory surge. May I have next slide, please? Thank you. So in addition to RSV, we are still seeing a small number of COVID as well as other viruses popping up right now. Flu is one of the primary viruses we're seeing after RSV, but we're also seeing something called parainfluenza and enterovirus. Enterovirus is really what we see associated with vomiting and diarrhea. Our goal here is to expand our ability to take care of a large number of patients that are coming in through our hospital. Our hospital is licensed for 69 pediatric beds and 20 pediatric ICU beds. Currently, we are at 125% capacity, and that has been fluctuating between 125 to 130% capacity. We are not, we have always had respiratory surges consistently every single year related to RSV. And because of that, we have a surge tier plan that we have continued to utilize. This year is a little bit different because it came very quickly and the numbers were much higher than we've seen in years past. Our response to opening up additional beds have included turning private beds into semi-private beds, opening up a mass cohorting unit to allow RSV positive patients to be in a single unit. Right now, we are housing RSV positive patients within that. We also are utilizing our OR pre-op, post-op waiting rooms to help offset some of the pediatric emergency department numbers. At the end of the day, what we're seeing is when you have a large number of patients who are occupying inpatient beds, where the rest of the patients are in our pediatric urgent care in our pediatric emergency department. The impact on having pediatric emergency departments full is it limits our ability to pull patients from around the state who need continued care or a higher level of care, particularly with our subspecialists such as peds surgery. So we are working really hard to make sure that we can continue to bring patients in from around the state to receive the care that they need from our children's hospital. Additional areas that we are working to expand is to make sure that we have enough physicians to cover the large influx of pediatric patients who are requiring care here, either through our urgent care clinics, our primary care clinics, or inpatient areas. We continue to be impacted by staffing. Nursing, any kind of staffing within our institution does continue to be a concern, and we are working very hard to make sure that our patient-nurse ratios are safe and we can continue to provide high-quality care within our institution. The other impact that we really want to start making is community education. We want to make sure families are aware of what to do, when to stay home, when to go to urgent care clinics, when to go to pediatric emergency departments or other emergency departments. So we've been doing public service announcements. We have wanted to make sure families understand how to care for patients, their children in their home, and when is the right time to bring them in. The main thing we want to vocalize is when you come to any of our hospitals, particularly UNM Children's Hospital, you will get the care that you need here. You may have longer wait times, but you will definitely get the care. The other area that we are working on is statewide collaborations. It's important to understand what our other hospitals are seeing and what they're experiencing. We continue to have multiple discussions and collaboration with community hospitals as well as community providers. It's important that we understand what challenges they are facing and see how we can assist them and how we can come together as a team to help the very large surge of pediatric patients that every community in New Mexico is currently seeing. UNM Children's Hospital is also helping by sharing our current guidelines regarding cohorting, home oxygen, when it's safe to discharge patients on home oxygen, and again, just a lot of communication with our families. One of the things that we really want to emphasize the importance of vaccines. Children who are eligible for vaccines should get their flu and or COVID vaccine. If children are under 6 months of age, those are the children we really want to protect. So if you have a child who is under 6 months of age, we're encouraging adults, family members to vaccinate for the children who cannot be vaccinated. And I think that is all I have.
Thanks, Dr. Duran, for being with us today and working with us to get our arms as a state around this significant uptick in viral infections and hospitalizations in children for RSV. Just a reminder again to know the community level where you live. I've got a bookmark on my computer. I go in and check that. I already told you we post it in our offices here at work, and pay attention to those guidelines for low, medium, and high levels, and think about your own circumstances and those of your families. We're never going to stop talking about the importance of getting vaccinated. It is really has been and will continue to be the way that we preserve our most scarce resource in the state during this pandemic, which is hospital beds and nurses. And then get tested. We already heard from Dr. Perron how she did it this morning. I was recently out of town and monitoring myself for symptoms because I was on some airplanes, and you can still order tests and probably will be able to into next year at findatestnm.org. You can get a pack of 5 for each address. In New Mexico, once a month. Get treatment. We've already talked about that. The importance of getting treated right away to avoid hospitalizations. And then masks still work. I mean, one of the reasons I think we're seeing an uptick, when in many of these viral illnesses is mask wearing has really dropped off a lot. And so we are seeing an uptick in a number of things. And remember, this fight against COVID, we want to use as many tools as we can. So think about what county you live in. If it's orange or yellow, give some serious consideration to wearing a mask when you're out in a public setting, indoors in particular. And I think with that, we can go to the next slide. We just want to close with this video as we move into our Q&A time. So I'll turn it back over to you, Jody, after the video's done. Thank you.
It's a magical season for our little ones. But with the flu, RSV, and COVID all going around, you want to do everything you can to help them stay healthy. Keep this season magical by making sure hands are always washed, surfaces are regularly cleaned, and the whole family is caught up on their vaccines. Start by scheduling a COVID vaccine for your kid today at vaccinenm.org/kids.
All right, at this time, we'll take Q&A. If you have a question for one of our principals, please raise your hand in the chat. I see 2 hands raised. We'll start with Austin Fisher with Source New Mexico. After Austin, we'll go to Julia Goldberg with the Santa Fe Reporter. Austin, you're unmuted and you should be able to ask your question. I'm not sure what happened. We lost Austin. Yeah, so let's go to Julia Goldberg.
Thank you, Jody. Thank you, doctors, for the chance to ask 3 really fast questions. Dr. Scrace, they will be really fast and not at all confusing or annoying. Right before the pandemic, the health department had published annual data about vaccine exemption rates and had shown that there were pockets where they were rising, Taos and Santa Fe County in particular, and then areas in the state where they weren't rising, but there were a lot of students out of compliance. I tried to decipher the CDC school VaxView exemption trends earlier today, and I think as far as I could tell, it looks like everybody's sort of dropped off because schools were closed for the better part of 2 years. But I'm wondering if you have any sense of how those trends are faring as students are back in school in terms of both compliance and vaccine exemptions, because I haven't seen a more recent report since 2018, 2019. That's my first question. Do you want them all at once or do you want them? No.
So I don't know the answer to that one, Julia. I haven't seen a report recently either. I of course, we know vaccine uptake rates for COVID vaccines by age and all, but and I don't know, Laura, if you happen to have that on the top of your head either, but that's one we'll probably have to get back to you on.
Okay.
It's a good question.
Okay. And then my second question, Dr. Scrace, was you unveiled the COVID-19 wastewater surveillance report in September, and you'd mentioned there'd be a dashboard and more reports, and I can't find anything since then. So I was just curious what the status of that was.
Yes, that's been an area of intense involvement on my own part. And I was just talking to Secretary Kenny yesterday in the Environment Department. What had happened was we had the wastewater testing being done through the Environment Department. They had a contract with a vendor. And then when they bowed out of that in August, we switched over, but we really value obeying the law, which includes the state procurement rules. So right now, we're in the process of contracting between DOH and this vendor to continue the collection process and reporting the data. So there has been a pause that's longer than I wanted to say the least, but I talked with the folks working on that. There was one problem they had, and we talked about how to potentially solve that with the contract. So once we have a signed contract, that will be up. And I apologize for the delay because we did promise that, and we just weren't familiar with I wasn't familiar with the contract arrangements when I did promise that. But we're getting that contract going and should have that up and running, I'm told, by the end of the year.
Okay, thank you. And then Dr. Patahon, I was wondering if you could just explain to me, I don't understand on the monkeypox reports why race and ethnicity why and how they're being separated. It doesn't seem like it jives with how the CDC reports race and ethnicity. So like, for example, the most recent one says 75% of New Mexico's cases were among white men, but 48% were Hispanic for ethnicity. And I just didn't understand why.
Laura, you're on mute.
So, sorry about that. It's the way we break down race and ethnicity. So we have the race, the different racial groups, and then ethnicity, we have Hispanic and then non-Hispanic. I hope that answers your question. So it's like two different ways of seeing the data.
But then which is reported to this? I was just trying to compare it with the CDC and I couldn't figure out what.
Oh, the different, let me get back to you. I'm going to pull that up and then I'll get right back to you on that. Okay.
Julie, I think we report both. We routinely report, and you've seen it through the whole pandemic, race, which is white, African-American, Asian, Native American, and another one, Laura. And then
Yes.
as a subset of white, we have Hispanic and non-Hispanic, although Hispanic, non-Hispanic can be a subset of other racial groups as well. And so I think we report both.
Yeah,
Okay.
I see it now. Sorry, I just pulled it up so I could take a look at it. Yeah, those are the two ways exactly that. It's the two ways of breaking it down by race and then by Hispanic, Latino, or non-Hispanic Latino is how we report two different ways.
Okay.
Okay, well, maybe I'll just send a follow-up note to Jody, because just the way the CDC is reporting out New Mexico looks different than what we have, so I just wasn't sure how to read it. That's it, thank you.
Okay.
Okay,
Thank
Julia, yeah, we'll write you back about that. Yeah, I'll have to pull up the CDC report and look at that. Thanks.
All right, thank you, Julia. I'm going to go to Austin Fisher now. Austin, I'm sorry, we had a little technical glitch there. After Austin, I'm going to read a question from Marion Todd, and then we'll go to Jared Eppenreck from KUNM. So Austin, I'm hoping that you are able to unmute yourself and ask your question.
Hi there, can you all hear me?
Yes, we can hear
Excellent.
you.
Okay, so thanks so much for the time, y'all. I did submit a question ahead of time, and this is related to Dr. Patahon's her presentation of the data of ILI. So that might be helpful in this discussion. So earlier this week on Monday, the medical director of children's care at Pres said that the exceptionally high rates of RSV this year and the high number of children in the hospital are caused by a, quote, immunity gap. Could you explain to us what that means? And what a second part of this question is, I believe that Dr. Patahon's chart shows a very low incidence of ILI in the winter of 2020 to 2021. What do you think explains that?
Yeah, let me start, and then Laura, if you can embellish.
Yeah. of
Sorry,
course.
Dr. Perron can and Dr. Duran can too, if they want. I think, I don't think what the doctor said about an immunity gap kind of got reported the way he meant. And so, and there's no evidence to show any kind of immunity gap because I looked it up. But I think what's happened is we saw a remarkably low incidence of RSV and influenza for the past 2 seasons. And my belief is that's due to the fact that everyone was masked up for COVID, or even kids not in school where they're transmitting. And that is why we saw it. So I think what we're seeing now is what we used to see when people didn't wear masks all the time. And I don't think it's an immune system phenomenon per se. And so I think I haven't had a chance to talk to the doctor who said that, but we had a long discussion about that yesterday. I think we're in agreement that this is just, same viruses around have always been. We took extreme precautions with kids in 2020 and to a fairly large extent in the winter of 2021. And but now everybody's back in school. Many schools aren't suggesting masking anymore. And so I think that's what we're seeing is we're just returning to what life was like. I don't want to say the olden days, but 3 years ago when people just no one wore masks. Laura or sorry, I'm trying to be more professional here. So Dr. Perron or Dr. Duran, do you want to add anything to what I just said?
So, I absolutely agree. I think we are seeing more cases because we are taking less precautions. When, children are sick, we ask that children stay home. Many times families, because of work situations, they have to take them to daycare. And this is where children are mostly being exposed, or they're being exposed by their older siblings. So we know once a virus is within the community, it continues to spread. And the precautions that we were taking over the last couple of years we've been keeping our children, safe. We have been masking, we have been keeping other people who have been sick away from them. So yes, our precautions are a little bit different now, and I think we're seeing the effect of that. Same viruses.
Yeah. And yeah, I would just add that it's kind of a way to say masks really did work when we were, when we were being super careful, when people were super careful about COVID, washing their hands, keeping a social distance. So it kind of shows that, yeah, during that time period, we weren't getting as sick, kids weren't getting as sick, and just, we're seeing that now, the impact of not being as careful with our, practices.
All right, thank you, Austin. Next, I'm going to read a question aloud from Marian Todd. She's a new reporter with us. I think this is her first press conference. She's with the Santa Fe Reporter. She doesn't have the ability to ask her question live, but she wrote in the chat that when she got her shots, she had violent reactions of fever and chills, headache, and vomiting. And she wants to know if this is a typical response, and if we think that this may make people shy away from getting vaccinated.
Well, let me start, and I'm going to just, she doesn't say which vaccine she got, but I'm going to assume it's one of the messenger RNA vaccines, Pfizer or Moderna. Second, everyone is different. Initial data on the vaccines were that about 2/3 of women and 1/3 of men, rough percentages there, did have side effects from the vaccine. The vast majority were mild. I know I had something similar to what Marianne described when I got the Moderna vaccine. I'd have all Pfizer's otherwise, and it was pretty unpleasant. But and I think, yes, when people have a side effect like that, it might keep them from wanting a further vaccine. However, I would remind all those people who are thinking that way that having a night of chills and a fever and, trouble sleeping and then feeling pretty good the next day or two is a small price to pay compared to ending up in the hospital and ending up in the ICU, being on a ventilator. So it's really true for all vaccines. Like the vaccine stimulates our immune system. My theory is that that fever and chills and those symptoms I got were due to the vaccine actually working and stimulating all my cells to make the protein, the antibody proteins through the messenger RNA. So I think there are always going to be people who think that the risk of a bad day is too high, but I would just say as a physician, I've seen the people who ended up in the ICU, and I've had my own patients die from COVID. And so I think it's worth it, is what I would say. Anything else, Dr. Perron or Duran, on that one?
Excuse me, David, and I misspoke. She is from the Santa Fe New Mexican, not the Santa Fe Reporter. And she also let us know in the chat that it was the bivalent booster Moderna.
Okay, and I'm not dissing Moderna at all, because I got just as many friends who got the Moderna vaccine and then got one Pfizer and had a similar thing. So the vaccines work to the layperson identically, but actually to the scientist, they are a little different, and they have a different antibody set that they generate. So, when I get my tetanus shot, my arm gets sore. I try to go on an elliptical machine that night so I can, I don't know what I'm doing, working it into my system or something. So my arm is less sore. And my wife was really mad at me because she had more significant symptoms when she got her vaccines, and I had nothing at all, like not even a sore arm until the one I described. So that was my fourth. So every human's different. Those symptoms generally are indicative of your immune system being stimulated, which is the purpose of the vaccine. So in my own weird way, I found that reassuring when it happened to me.
All right, we have about 14 minutes left, and I have 5 reporters in the queue. We'll start next with Jared Ebenbrecht from KUNM, and then we'll go to Ryan Botel with the Albuquerque Journal. Jared, you should be able to unmute yourself and ask your question.
All right. Thank you so much. Hopefully you can hear me. Looks like, yes. Okay, great. So 2 quick questions on 2 different things. One, given the RSV surges and the pediatric surges and hospitalizations, there was some projection from the Tuesday presser that today there would be some projections of like where we think that's going, how long the surge, because there seems to be a debate out there of will it peter out and we're just early on and then it'll flatten out, or do people expect it to continue to grow through the rest of the remaining months? Then the other related question would be probably more for Dr. Scrace. Given the extension of the public health emergency order at the Biden administration level past January, how does that impact NMDOH planning, resources in preparation for COVID as you move into this fall and winter surge? Those are the 2 questions. Thank you.
Yeah, let me do the second one first, because I kind of forgot the first one, but I'm hoping that Drs. Duran and Perron are ready for that one. I think this is technical, but it's true. The public health, the Secretary of Health and Human Services, the law says they can declare or extend a public health emergency for up to 90 days. It's not just 90 days. And so at HSD in particular, where the massive tsunami of re-enrollment in Medicaid and SNAP and the change in benefits are occurring, we're still planning on being ready to go on February 1st, because it's equally, I think most of us think, oh, it's being extended to January 11th, so that means it's going to go through April. And I don't think there's reason to believe that, because there's lots of other signals about maybe winding this down. I think I've heard that some of the reservation about just bringing it to an end or making that 60-day in advance announcement that the governor's been promised from the president is because of the recent uptick in cases, but we're going to have that, something like that, I'm suggesting, every winter. And so we're not changing our plans at all just yet. We have to tweak our financial projections for the legislature, but we're still going full bore to get everything up and ready, get people notified. And since you gave me the opportunity, even though it wasn't a slide today, if you're one of our 1,048,776 customers this month, and you have not updated your address in our system in over a year, please go online, get your address updated, because that is the way you'll know when it's time to renew, and you have to renew in order to continue your benefits. So more on that later, maybe even our own press conference just on that topic when we're closer, but I really appreciate the opportunity to talk about that, Jared, and I thank you for bringing it up. And I did remember the other questions. What are we predicting? I'm surprised that people said by today we would know what how long the surge was going to last, because I think if we're lucky, we'll know that we'll have some predictions this year. But let's ask Dr. Duran what she thinks, because she's in the thick of it.
Yeah, historically, RSV has started usually mid-December. We are about 6 weeks before. It will peak around end of January and then really pewter off at the end of March. So, the big concern are the holidays coming up. We're anticipating seeing more of a surge just because people are, they want to see one another. And so, the ask is, please, if you are ill, please stay at home. There's another time to see your family. So what that surge is going to look like is still in question, because we are very early to be in an RSV surge right now. So predictions could be as late as March. I'm hoping it's much sooner than that.
Okay.
All right, thank you, Jared. Next, we're going to go to Ryan Botel with the Albuquerque Journal. You should be able to unmute yourself and ask your question.
Hi, doctors. Thanks for taking our questions. I'm kind of just going to piggyback off that question. I was wondering just what are your general recommendations for holiday gatherings and travel? What all would you recommend?
I don't know what your outlet is. You're not in.
Am I not on?
No, we hear you.
Oh, sorry.
In the background, but
Okay, yeah. So I was just wondering what your general recommendations are and what folks should be taking into consideration. And also, if I could get another question, is Los Alamos and the Department of Health still doing COVID projections? And if so, when it comes to deaths and hospitalizations, what can you tell us about what you're expecting for the near future?
all right, let's talk about holiday recommendations. Dr. Sparrow and Duran, and we've gone over some of them already, but I would just throw in there, don't go to Thanksgiving dinner if you're sick. Stay in your bedroom and have them bring you a plate, and maybe watch football in your room or something and have them bring you a TV, but don't mingle with the rest of your family over the holidays if you're sick. But that's pretty high level advice. Dr. Perron, what do you have to add?
Yeah, I think also just adding about caring for our elders, just the fact that if you have older family members, they're the ones who are going to get sickest from flu, from COVID, from RSV. So taking care of, our oldest people. So if you are thinking of visiting, maybe consider taking a rapid test that day before you go to visit your family members. And then also, of course, stay home when you're sick, and please get vaccinated if you haven't been vaccinated yet.
Dr. Duran.
I'm going to echo those very intelligent words. We want to keep our family members sick. Let's keep sick at home and keep well so we can continue to visit with our family.
One more thing too to add in at the end, I just thought of is, Thanksgiving weekend, I think, is the highest airplane travel day of the year or days of the year. And I really recommend wearing an N95 mask on a plane. I was on 4 flights over the weekend to see some grandkids in Michigan to celebrate my son's birthday. And I wore my N95 all 4 flights. In the airport, also wear it in the airport. I think that airplanes and airports are a place where people are coming from all over, and much higher risk of contracting a virus being in a closed space for a long period of time, independent of the air filtration system in the airport or on the plane. So that'd be one too. I'd ask, our family all does that, and we all wear N95s on the plane, but I really strongly recommend that if particularly when you have like grandparents and then people coming to visit from out of town, like be extra cautious. All right. Thanks, Jody.
All right, thank you. We have one hand raised. It's Marion Todd with the Santa Fe New Mexican, but I don't think she has mic abilities. So I think we can wrap it up there. Marion, yes. And Dr. Grace, I'll leave it to you, and Dr. Patahon and Dr. Duran for final words.
Okay, let's go in reverse alphabetical order. No, in alphabetical order by last name. So we'll start with Dr. Duran, then Dr. Patahon, then myself.
Thank you so much. You know, I really just want to thank our communities. We know this is a challenging time, and we will continue to work together, and we will get through this. We do respiratory surges every year, well, except for the last 2 years, but we will get through this. Thank you.
Thanks so much for, once again, helping spread the word. They say that actually only 19% of people actually tracking on COVID as much as they did before, which apparently it was 79% people were really tracking on it. So I think the work that you guys do in media is so important to keep the message alive of, you know, how to prevent our community from getting sick, and you know, we know people are still dying and getting sick, so do everything we can to get vaccinated, stay safe. If you are gathering and see a lot of people, you know, wear a mask, because that'll also prevent you from getting sick. And also, once again, just the message to get vaccinated. So thanks so much for all you do. And yeah, that was great, Dr. Duran. We'll get through this, and our community view is stronger for it. So,
David, before you take over there, Ryan Botel from the Journal asked in the Q&A if we have an update on projections for COVID.
Oh yeah, I apologize. We are still meeting with Los Alamos. We do have the modeling team meeting every other week. I think the modeling team and our models, because we have a bunch of them, are projecting something very similar to what has already happened in England, which is a somewhat a rise similar to what we're seeing now, with a quick peak and then coming back down with about 8 weeks from beginning to end, which is much, much shorter than many of the other peaks that we've had. And so, you know, we first got into this 4 weeks ago. So I think that's what we're projecting. I think hospitalizations, as you remember, come peak about 7 to 10 days now after the case counts peak. Deaths, of course, 2 to 4 weeks after case counts peak. So we will see more hospitalizations. We've seen a double during this time period, and we will see more deaths, unfortunately. But sorry I didn't answer that question earlier, because that you did ask that. So my error. And then just in terms of closing comments, we're going through a fairly detailed exercise at the Department of Health and with a lot of our partners. It's called an after action report to evaluate what happened during COVID. What did we do well? What didn't we do well? What were we prepared for? What weren't we prepared for? And so that's still in the works, but some fairly extensive meetings over the past couple of days. And one of the ones I was in was this morning for the leadership group that's been kind of managing the pandemic, different cabinet secretaries, most of whom you've met here, and National Guard and others. And one question was, what did we do really well? And there are a number of expected answers, like vaccines and testing, where New Mexico led the nation, but a number of people put communication. And as we talked through that, it wasn't like we're such great communicators, but it was the fact that the media as our partners just did an unbelievable job of getting the word out. You know, communication probably is the #1 challenge in almost any emergency. You know, we did reflect today on the fact that when we got into this, no one thought it was going to last 2.5 years. And so that's been pretty grueling and taken a real toll on healthcare workers across the state and the nation and the world, and public health workers as well. And we did a little polling today and saw that a lot of those stress-related symptoms and anxiety, depression, and PTSD symptoms still exist in much higher levels among public health workers than the general population, even though things have lightened up a little bit for us. But I just can't thank you enough for communicating. Also, just to point out again, I do this maybe once a quarter, but we're still revising how we do things based on the questions you asked. So Julia, I'm really interested now to know what's going to happen. You know, what kind of vaccination declination rates we're going to see, you know, in the coming year. But again, I don't know that, and what kind of penetration rates we'll see for the respiratory viruses, influenza, and COVID. I sure wish we had a vaccine for the current #1 virus that we're struggling with, but maybe that's in our future as well. And maybe the technology we've used with COVID will give us some insight into how to better combat RSV. But just in closing, thank you all for your attention, your time, your good questions. We still consider you our partners. Everybody who today was talking about our success in communication and talking about how we wouldn't have been successful without your help, your questions, and you're getting the word out. So thanks for doing that. Thanks for continuing to do it. Thanks for your interest. And we will continue to find ways to keep you informed about what's happening with all the respiratory viruses as we head into the winter months.
All right, that concludes our press conference today. Slides will be coming out shortly to those reporters that RSVP'd for this press conference. Thank you again.